My name is Hannah Sharp. I am a junior in the Bachelor's of Health Science Pre-Occupational Therapy program, and the special population I have chosen to do my Power of Three video presentation on is prisoners with mental illness. I will focus on this population of individuals and their access to healthcare, as well as the quality of healthcare they are receiving while incarcerated.
Just by getting large numbers of people together, you're going to get people with mental illness. That's going to happen, but it's disproportionately seen in the offender population. And some research suggests that is related to the discharge of people from psychiatric wards. Mental health is a big problem in the prisons, and I think the focus should be what can we do to help them, and that should be the rehabilitative focus. Most academics focus on rehabilitation, and not all prisons do. A lot of it's just on punishment, retribution.
The United States has the largest prison system in the world. Alone, America makes up 5% of the world's population, but 25% of the world's prisoners. Of that 25%, people with some kind of mental illness make up half of those who are incarcerated. This percentage is very disproportionate, seeing that only 11% of individuals in the U.S. have a mental illness. Although the amount of people with a mental illness that are imprisoned equal to such a great number, their access to healthcare and the quality of care they receive is far from great. People say that the right to healthcare is a central human right, and any person, regardless of legal status, is entitled to receive sufficient healthcare. However, the United States prison system seems to fall short of meeting usual standards of care. Many consider that this may be the case due to a lack of resources, along with a conflict of interest between suitable healthcare procedures and safety protocols. A disproportion between the supply of resources and the demand from patients within the U.S. prison system is a great reason for the gap of access to healthcare services for incarcerated individuals, especially those suffering from a mental illness. Medical care alone accounts for about 12% of prison budgets, and cost concerns for certain areas of treatments are a severe issue. However, mental health care for the mentally ill population in prison is, unfortunately, both crucial and expensive. A 2006 Department of Justice study found more than half of all inmates have a mental health problem compared to 11% of the general population. Mentally ill inmates are often inappropriately treated due to the lack of knowledge about the rising mental health population, along with a lack of means to treat the cases at hand. The supply of resources and treatment facilities for this special population is challenged with high demand and overcrowding of prison systems. Recidivism is defined as a repeated arrest. A few studies have seen an association between psychiatric illness and the risk of having a repeat of incarceration, and statistics have shown that prisoners with a mental illness were more likely than prisoners without a mental illness to have a current or past violent offense. A hypothesis related to recidivism includes criminalization of mental illness. Criminalization of mental illness indicates that if the mentally ill that are in prison had received the psychiatric services they needed, then they would not be in trouble with the law. In addition to this, the main duty of prisons is to keep society safe, so security is the primary concern. The most obvious hurdle to providing mental health treatment is to maintain security within the institution and providing a safe environment for both staff and inmates. Because of this, healthcare necessities for special populations, such as the mentally ill, often get lost in the mix. The need to identify and treat inmates that are mentally ill is essential, and relationships between correctional systems and mental health systems must be established, but there is potential to advance healthcare in the criminal justice system. From a public health perspective, shifting a number of inmates to community-based supervisions could allow an increase in access to numerous health services for individuals with varying needs. In addition, in the long-term setting of prisons, clinicians can diagnose and effectively treat chronic infectious diseases prior to their release back to their community. To conclude my video, I have two discussion questions. 1. Are the prisons in the United States fit to give such specialized care to those with mental health impairments? And 2. Why is it that the standards of care for psychiatric disorders are not as respected in a correctional setting as they are in other community settings?